Imagine waking up one morning and realizing that your own body no longer responds the way it used to. Your hand begins to tremble, your steps grow smaller, and simple movements suddenly require tremendous effort. For millions of people across the United States and Canada, this experience is not temporary. It is the daily reality of Parkinson's disease, a progressive neurodegenerative disorder that slowly alters movement, behavior, and quality of life. Today, this in-depth medical exploration will take you inside the brain using advanced 3D visualization to uncover the true biological mechanisms behind Parkinson's disease, explain why dopamine loss devastates the motor system, and reveal the most advanced treatment options available, including L-Dopa therapy and deep brain stimulation. If you or someone you know has been affected by this condition, this information will be essential. Parkinson's disease is driven by the degeneration of highly specialized neurons located in a small region of the midbrain called the substantia nigra. These neurons are responsible for producing dopamine, one of the most important neurotransmitters that regulate movement, motivation, emotional balance, and automatic bodily functions. Our visual model shows that Parkinson's symptoms typically begin after approximately 60 to 80% of dopamine-producing neurons have already died. Once dopamine levels fall below a critical threshold, the basal ganglia, the brain's central control hub for movement, can no longer coordinate smooth, fluid, intentional motion. This breakdown in communication creates the hallmark motor symptoms: resting tremor, muscular rigidity, bradykinesia or slowness of movement, and postural instability that increases the risk of falls. Tremor is often the first sign, beginning subtly in one hand. As dopamine continues to decline, rigidity sets in, causing stiffness in the limbs, neck, and torso. Bradykinesia makes simple tasks such as buttoning a shirt, writing a sentence, or standing from a chair extremely slow and difficult. Eventually, balance problems become prominent, significantly impacting independence. Although Parkinson's disease is known as a movement disorder, its impact extends far beyond physical symptoms. Non-motor symptoms often appear years before tremors begin. These early signs include loss of smell, constipation, sleep disturbances, vivid dreams, depression, anxiety, and subtle cognitive changes. Research in the United States and Canada confirms that identifying these early non-motor symptoms can allow for earlier diagnosis and better long-term outcomes. Understanding the full spectrum of symptoms is essential for both patients and caregivers. At the cellular level, one of the defining features of Parkinson's disease is the accumulation of Lewy bodies, abnormal protein deposits primarily composed of misfolded alpha-synuclein. These protein clumps disrupt normal cell function, damage internal structures, and contribute directly to neuron death. As Lewy bodies spread throughout the brain, additional symptoms such as cognitive decline, mood disorders, and autonomic dysfunction may appear. Scientists today consider alpha-synuclein pathology one of the most important research targets in the development of disease-modifying therapies. To this point, if this detailed breakdown of the biological mechanisms behind Parkinson's disease has been helpful, take a moment to subscribe to the channel. Your support allows us to continue producing high-quality medical education content for patients, caregivers, and healthcare professionals across North America. You can also share your personal experience or your loved one's story in the comments. Your words may help someone just beginning their journey with Parkinson's. And please consider sending this video to a friend or family member who could benefit from clear, science-based information.
The current gold standard treatment for Parkinson's disease is L-Dopa, a medication that the brain converts directly into dopamine. Our 3D animation demonstrates how L-Dopa temporarily restores dopamine levels within the basal ganglia, improving symptoms such as tremor, rigidity, and bradykinesia. However, over time, the brain's ability to store and regulate dopamine declines, and patients may experience motor fluctuations or dyskinesias, which are involuntary movements caused by long-term medication use. While L-Dopa remains essential, managing its long-term effects requires careful clinical guidance. For individuals with advanced Parkinson's disease who struggle with severe motor symptoms, deep brain stimulation offers a powerful therapeutic option. DBS involves surgically implanting electrodes into targeted brain structures, most commonly the subthalamic nucleus or the globus pallidus internus. These electrodes deliver controlled electrical stimulation that helps normalize abnormal signaling patterns caused by dopamine loss. Patients often report significant improvements in motor control, reduced medication requirements, and increased quality of life. DBS is one of the most effective neuromodulation therapies ever developed and continues to transform care throughout the US and Canada. Beyond medication and surgery, comprehensive Parkinson's management includes physical therapy, occupational therapy, speech therapy, and structured exercise programs. Scientific evidence shows that aerobic exercise, strength training, balance work, and even dance-based therapies produce neuroprotective effects and improve functional mobility. Many clinics across North America now integrate multidisciplinary care teams to maximize patient outcomes. The future of Parkinson's disease treatment is promising. Researchers are investigating gene therapy approaches aimed at restoring dopamine production directly within the brain. Immunotherapy trials are targeting alpha-synuclein in an effort to stop the spread of Lewy bodies. Stem cell-based therapies seek to replace lost dopamine neurons. Advanced imaging technologies and biomarker development may soon enable diagnosis decades before motor symptoms begin, opening the door for early intervention. Precision medicine, personalized treatment programs, and disease-modifying therapies could completely reshape the Parkinson's landscape in the coming years. Parkinson's disease is not simply a movement disorder. It is a complex neurological condition that affects nearly every system of the body. It places a heavy emotional and financial burden on families and caregivers, especially in countries where long-term care costs continue to rise. But knowledge is the strongest tool we have. Understanding the neurobiology, recognizing early symptoms, accessing evidence-based treatments, and remaining informed about ongoing research empowers individuals across the United States and Canada to take an active role in their own care. As we continue to expand our understanding of neurodegenerative diseases, one truth becomes increasingly clear: education saves lives. When people understand what is happening inside the brain, they are more prepared, more proactive, and more equipped to seek help. If this in-depth explanation of Parkinson's disease has been valuable to you, remember to subscribe, share your experience in the comments, and pass this information forward. Someone you know may be searching for answers right now. Understanding Parkinson's disease, from the cellular pathology to the groundbreaking therapeutic breakthroughs, provides the knowledge necessary to face this condition with clarity, resilience, and hope.
Parkinson's prevention. What you can do today. While there is currently no guaranteed way to prevent Parkinson's disease, decades of research from leading medical institutions in the United States and Canada show that certain lifestyle choices can significantly lower the risk and delay the onset of this neurodegenerative disorder. Protecting your brain starts long before symptoms appear, and even small changes can make a measurable difference. The strongest scientific evidence points to regular physical exercise. Aerobic training, strength workouts, cycling, swimming, and even fast walking help protect the neurons that produce dopamine. Studies show that people who exercise at least 3 to 4 times per week have a dramatically reduced risk of developing Parkinson's. Consistent movement increases neurotrophic factors, improves mitochondrial health, and keeps the motor circuits of the brain active and resilient. Another essential pillar of prevention is maintaining a brain-healthy diet. Diets rich in antioxidants, omega-3 fatty acids, leafy greens, whole grains, berries, and olive oil help reduce inflammation and oxidative stress, 2 major contributors to neurodegeneration. The Mediterranean or MIND diet is strongly associated with a lower risk of both Parkinson's and other neurological disorders. Environmental toxins also play a major role. Exposure to pesticides, industrial solvents, and contaminated groundwater has been linked to higher Parkinson's rates across North America. Whenever possible, choosing organic produce, using protective equipment, and avoiding contact with harsh chemicals can significantly reduce toxic exposure. Sleep is equally important. Deep, restorative sleep helps the brain clear harmful proteins, including abnormal alpha-synuclein. Chronic sleep deprivation increases inflammation, damages neurons, and accelerates neurological aging. Finally, staying mentally and socially active strengthens the brain's resilience. Complex learning, reading, problem-solving, social engagement, and cognitively challenging hobbies build neural pathways that help protect against neurodegenerative decline. While no single strategy can fully prevent Parkinson's, combining exercise, a healthy diet, toxin reduction, sleep regulation, and mental stimulation can dramatically improve overall brain health. These habits support dopamine-producing neurons and provide powerful long-term protection for your nervous system.